episode that we are going to speak to the CEO of City of Whittlesea, Craig Lloyd, in relation to the current scenario that's going on within City of Whittlesea about the COVID-19 hotspots and the information relating to that. So we want to we will be speaking to Craig, and I'll bring him on the screen with me. Welcome to Sing Station, Craig. How are you doing today?
Yes, very well, Gurinder. Thank you. How are you going?
I'm doing well as well. Thanks for giving us time. And in relation to, we understand this is a very unfortunate situation that's happening at the moment. We were not expecting this to come back, especially in the City of Whittlesea. How are you dealing with this at the moment?
Look, you're right. It is very busy, and it is very disappointing that we're having these outbreaks. And I think it's fair to say that we've been warned by the Chief Health Officer all throughout that we will see outbreaks, and unfortunately it's happened to us. And as we speak, I think we're up to 15 cases now in the state, and
That's
exposure sites that are now starting to pop up right through Victoria. But 19 of the currently listed exposure sites are within the City of Whittlesea.
Yeah, that's very concerning, and we understand there is a community concern coming up. Everyone is rushing to testing sites. Could you please briefly tell us about the exposure sites that's been active in the City of Whittlesea?
Yes, I can. Do you want me to step through them all, or how would you like to do that?
We can list them on the screen as well. So maybe the major ones, if you can just the tier one, if you could just let us know.
Yeah, I think the important part of the message is that the information is changing continuously, and as of this morning,
Yes.
a whole load of additional sites have been added. So in and around the City of Whittlesea, the Jump Swim School in Bundora was one of the first sites. That was a tier one site. If you've been to that location recently, hop onto the Department of Health website and check the dates and times to see whether you need to get yourself tested. We've got quite a few sites now in and around Epping. We have the Chemist Warehouse in Dalton Village in Epping is a tier two site. And we'll talk a bit about what tier one and tier two means. Yeah. The Furniture Trader in Epping, JMD Grocers and Sweets in the High Street there. Nando's in Dalton Road in Epping is another site. The Epping North Shopping Centre, that's a very heavily used shopping centre by the residents of that area, of course. House and Party, which is a store in Epping. Where this all started, the Woolworths in Epping North, and there was obviously some confusion with the Department of Health around that one quite early on. So to be really clear, it's the Epping North Woolworths, and that's the one in Lindarum Drive in Epping that is the particular site there. The Urban Diner Food Court at the Pacific Epping Shopping Centre, again, another heavily visited area. The Aldi in Epping, likewise, and the Chemist Depot in Epping as well. Woolworths in Epping, this is the other Woolworths, and the Coles as well, which I'm sure you're very familiar with. And then we also have exposure sites as well in Laylaw. We have the Deep Indian Supermarket, which is in the High Street in Laylaw. Fruits of Laylaw, again in Station Street in Laylaw. And the number one fruit market in May Road in Laylaw. And the last one in Laylaw at the moment is the Everfresh Fruit Market as well. We've also got one, the Bunnings Warehouse in Mill Park is the last one of those. So they're all those ones. There's a couple also in Thomastown as well. The Actrol, which is a retail store for refrigeration services. So that's likely to have visited there if it's connected to your business or you're picking up parts or similar. And White Line Automotive as well in Thomastown. So lots of sites. I think there's about 40 sites listed on the DHHS website at the moment, and as I said, 19 of those are in our municipality. So what you really need to do, because these keep... Sorry, go on, Gurinder.
No, it's a significant concern, 19 sites, and every single site that you have mentioned, I feel that I usually very frequently go to these particular sites as well, and they look very familiar. And I understand, Craig, there is a fear amongst the community, even if you have not visited in the same time slot, how safe is it for the community to visit those hotspots?
Look, visiting those stores once the Department of Health have declared them is safe. So there was cleaning requirements that those businesses would have been required to go through, depending on what they're advised by the Department of Health. So no fear there. The best thing you can do to protect yourself at the moment really is three things. One is wearing a mask when you're visiting anywhere that's indoor, in line with the new restrictions. Maintaining social distance and hygiene, that's really, really important. And I think we all got a bit complacent on some of these things when we didn't have cases. And the third one, and the most important one, is if you're eligible, please go and get the vaccine. It's the only way that we're going to stop having these outbreaks and the impacts on all of our lives is to go and get a vaccine.
Yeah, yeah. And we understand there is a greater community like who is going for testing at this stage. Are there any additional like testing sites which have been set up in the city of Whittlesea?
Yes, so there are. So you can get tested at the Northern Hospital facility. There's also a number of other sites that are temporary sites. The Epping Memorial Hall, which if you're living Epping, you'll be very familiar with that building. That's being operated by the Department of Health. And Gilwell Park in Laylaw. And I understand there might be some additional sites as well. My advice on getting tested at the moment is hop onto the Department of Health website, and there's a page there about getting tested, and it lists all the locations that you can get tested, but it also gives you advice on how long the current wait times are. So if the site nearest you is very busy and it's a long wait, it is completely fine to drive yourself to another test centre with a shorter queue. So I'd encourage people to do that, but certainly checking that website. There have been some long delays at sites. We've just got to be patient. The state government's putting on more and more testing, more and more test lanes. It's just a huge demand of people needing to get tested. So we've all just got to be patient.
That's right. I myself got a test done just a couple of days back, and it took me more than an hour. So I think an hour waiting time is very genuine at this stage with when we know we have significant number of cases and different hotspots in the city of Whittlesea itself.
And thank you for doing that, and thank you to everyone that has gone and got tested. It's a really important part of us getting on top of this, and for the Department of Health's contract tracers to really get and understand about the spread of this. And they're doing a very good job, and the reason that we're seeing more exposure sites listed is because of the intelligence and the work that they've been doing. So we thank them as well, because they're working very hard on all of our paths there.
Yeah, absolutely. And Craig, when you mentioned about get vaccinated, and so how many sites or whereabout the public can go for vaccination? Is it free to and available to everyone, or is there anything Medicare involved with that?
Yeah, so there are a couple of mass vaccination centres that anyone can turn up to that is eligible, and I'll talk about that in a moment. So we have the Northern Hospital has a vaccination centre. We have a special mass vaccination centre that's now open that I'd encourage you to attend. It's not long wait times at all at the moment. At the Plenty Ranges Arts and Convention Centre, which is the arts centre right next door to the main council building here in South Morang. That's operating, I understand, 10 till 4:15 every day this week, and that's likely to be extended as well. There are also 23, at the last count, GP surgeries across the city of Whittlesea that are also offering the vaccine. So if you're unable to get along to one of the mass vaccination centres, there's certainly lots of GPs that can provide you advice and provide those vaccines as well. So the vaccine is free to all eligible people. At the moment, anyone over 50 and anyone that falls into the 1A and 1B categories. So if you have an underlying health condition, if you're a healthcare worker or an emergency services worker, and there are some other categories as well, then you are eligible. It's free. It's completely safe as well. And I think that's a really important message for the community, that there's lots of misinformation out there about the safety or the efficacy of these vaccines. All the health advice shows that they are safe and they are the best ways to keep ourselves free of the vaccine and protect not only yourself but also your family and your community too.
Definitely. And we know that the city of Whittlesea is a home to a number of a significant population of migrants and international students as well. So it's important that they are aware that this vaccine is free of cost, and everyone should be going for it.
Yeah,
And I
that's
understand.
a really important message. And I
Yeah.
think the other thing that as community members we can all do is that we know that there are people in our community that for language reasons, or it may be that they're isolated people
Yeah.
that live on their own, they might be elderly, that we reach out and look after each other and let them know about the vaccine opportunity and that where the hotspots are. I think we've all got a responsibility to look after each other. And you're right, we've got a lot of migrant community
Yeah.
members as well. And for a lot of people who don't speak English as the first language, those that
Yeah.
do can play such an important part in sharing this information.
That's right. And Craig, we understand community still will have a lot of fears and everyone has got their own perceptions. Is there any dedicated line or help desk within City of Chelsea where people can just talk about their concerns or any mental health support as well?
Yeah, so all of that is accessible via the number that I gave you earlier on, and the COVID hotline. They will put
Sure.
you in touch with the right people. But I think the best advice, if you're uncertain about the vaccine in particular, is to have that conversation with your own GP. They know
Hmm.
your own health situation and what it means to you. And so I'd always
Absolutely.
direct people to go and see their own GP. But there's been lots of information about the risk of blood clots and things with the AstraZeneca vaccine, but all of the evidence shows, and last night had the opportunity with some community members as well to meet with the
Hmm.
Deputy Chief Health Officer and others. And the information and all the advice is that the risk is very, very low and that you're more likely to be injured on an aircraft or being run over in the street than you are experiencing blood clots or any of those other side effects. So I think if you're at all nervous, weigh up your options, talk to your GP. If you
Yeah.
do attend one of the mass vaccination centres, the doctors and the nurses that are there will also talk you through your individual circumstances and answer any of the questions that you have around the vaccine as well. And they take the time to do that.
That's right, yeah. And with reference to language translations, we'll try to translate the latest guidelines in Punjabi language as well. And also, I think there are services on and websites where some translated material is available. So for the people who are actually looking for some translated, I think they can visit those websites, and we'll add those resources on this particular interview as well.
Yeah, certainly the Department of Health website has information available in many languages, including Punjabi, but also,
Hmm.
as of yesterday, the main health advice is available in 60 different languages on the Department of Health website.
Sure.
But look, if you get stuck and people are having difficulty understanding the material, you can contact council, you can contact the coronavirus hotline, and we'll do our best to help answer your questions.
Sure. So I think the advice to the community at the moment is to follow the health guidelines that's on the DHHS website. We will be sharing the links on in this interview on the footer of this interview as well. And Craig, do you have any last comments or any more information you would like to add?
Look, I think the main message at the moment is that we just need to stay calm, keep working together, and keep being responsible as well. If you have been to an exposure site, or if you haven't and you feel any symptoms whatsoever, that might be just a runny cold or what we get in winter normally, don't take
Hmm.
the chance that it's just a normal winter cold or flu. Go and get tested. It's the best way to keep us all safe. And we've been through this before. We've got through it before. And the way we got through it before was all sticking together as a community. And I think that's the most important message is just all just keep working together.
That's right. And just a final question, Craig. I understand that there has been some news in the national media about traveling from other states to, sorry, traveling from City of Whittlesea to other states and even New Zealand. There has been some restrictions put up over there. Is there any particular website or resource where people can look up that information before they plan for any traveling from here?
Yes, there is. If you visit, if you go onto a search engine and you just put coronavirus in and Australian government, have a look at the federal government website. There's information up there. As I understand it at the moment, there are restrictions for all Victorians entering Western Australia and
Yeah.
uh, Queensland very specifically have said if you're from the city of Whittlesea, you're not allowed to
Mm.
enter Queensland at the moment. But look, I
That's right.
suspect over the next few days that information will change and various states will do different things. So
Yeah.
if you are intending to travel, you need to visit the website of that state or have a look at the Australian government website.
Sure. And do we know until what date the current guidelines are actually applicable?
Yeah, there's different information on that. At this stage, I think it's really much day by day is what the Department of Health is saying. I think it's fair to say that the mask restrictions will be in place at least until the end of next week, was the advice that the acting Premier gave yesterday. But in terms of other conditions and restrictions, it's really a case of monitoring the information that's released every day. And I suspect that will keep changing depending on
Sure.
the number of cases we're having and where they are.
All right. Thanks, Greg. Thanks for your time. And we just urge community again to stay safe, stay healthy, and stay updated with the latest health guidelines and wear masks as well. So thank you, Craig. Thank you for your time today.